The most common symptoms of spinal stenosis appears on the legs. Numbness comes out rather than pain. But numbness is not always produced. It usually comes on the early stage or mid-term, mainly when standing or walking position. Especially, symptom arises more often with walking motion. The reason is when we standing, our back curved front to back so the nerve in the back is pressed and narrowed. The nerve passage is narrowed and produce symptoms. When you walk, it is pressed by gravity, so the symptoms get worse. Lots of spinal stenosis patients complain it is hard to walk for a long time, even 400 meters. Sometimes 10 meters also difficult to walk. They complain like that. I've consulted them and they said when they starting to walk, they feel numbness and that hinders their walking. But pain gets better after sitting and resting. That is the first symptom. After that, back pain occurs. Severe back pain occurs rather than numbness. That is because the stress on the back increased. I've mentioned already, if you stand upright, nerve passage is compressed. Symptoms of spinal stenosis produced. Due to compensation movement, you are trying to bend your back more to get rid of pain. Because the back is bent, stress is attained. It produces back pain. And thirdly, patients having a hard time to get up and walking. A little different from the symptoms above. When patients sit down and try to get up, their back doesn't straighten. It takes a long time for the back to stretch and take too long to walk. Patients always complain like that. Sitting and bending position, your back is more comfortable. But back pain arises and trying to walk, the nerve get pressed hard to your back, stretched. Starting to walk makes symptoms more difficult. I've talked about 3 typical symptoms of spinal stenosis.